I would like to introduce Dr. Ravi Manikonda. He is one of my consultant colleague and will start the presentation.
Okay, so our presentation, we are going to try it, three of us together. I'm just going to make a brief start before Dr. Goel takes over again, and Helen will be contributing towards the end as well. So our little project was making diabetes ordinary so our children and young people can be extraordinary. Next one, please, Sunil. So the purpose was to improve based on our previous feedbacks and the NPDA feedback in particular. We felt to improve the patient and the parents' experience of the clinic attendance, paying attention particularly to the equity across all clinic sites, because we had multiple clinic sites and we wanted to bring some equity between all places. Okay, the next one. I don't know whether it's visible, but is there a way we could make it try and bigger, Sunil? Just the screen, maybe?
No, I don't think I can make it bigger.
No?
Relatively all right, so I think you're fine to keep going.
Okay, that's absolutely fine. Okay, so I can go through this slide in.
Yeah. Okay. Yes.
Oh. So we had a peer review in October 2018, and we had a feedback that we need to improve our clinic, the way we run our clinic, and so that our patients and the parents can have a better clinic experience. So in view of this, we submitted our RCPC application to join the QI journey, and through our monthly multiple team meetings, we decided that we should work towards improving clinic experience for our patients. We did gain the initial feedback from the parents, and as a team, we felt that we were not getting honest feedback from the patients. Maybe they were a bit worried that So we joined this QI journey. Following this, we arranged a big team meeting in which we also invited ABCI team, our local QI team, and we went through a process map of patient or parent journey through when they attained our clinic appointment. We looked at each process very minutely, and then the issues which came out of this big meeting were that there were number of people in the clinic room were many, and which can be a cause of discomfort to the patients and the parents. We noted that we were doing HbA1c and download in the consultation room itself, which can be sometime very time consuming, and which can take away part of the clinic appointment time as well. We noted that all of the clinic staff were writing their own notes, and that may raise an issue with the engagement with the parents and the patients while they are sitting in the clinic. So we concluded with the clinic, with this big meeting, that we need to test or trial a new change in one clinic area, and to show that it works, and then to roll out the change to the other clinical areas. We agreed that we need to involve wider team members, including the clinic support staff and the booking center team. We also wanted, to gather more feedback from the families and the patients regarding the layout of the rooms and the clinic. We wanted to make sure that we sub-process of each problem identified. Okay. So through this QI process, we introduced multiple small interventions which we found were helpful and improved the outcome. Before I elaborate those, first and the foremost, I want to say that our clinic template changed, and we were able to provide 30-minute consultation slot to the patients. that had the huge impact on the quality of the patient care we deliver. We noticed both parents and the patients and the staff satisfaction. The first and the foremost intervention was introduction of the unified clinic sheet. After several drafts and discussions, we were able to roll out our unified clinic sheets, which was being filled by one of the staff member during the consultation and signed by all the staff members later on. During this process, we also discussed and resolved the governance aspect of the medical record keeping. The next was we identified some issues with the booking process. We identified the reason behind we were not able to give 4 consultant appointments a year and started the discussion with the booking center team, which we found was very helpful. Next was we carried out a staff survey, making Survey Monkey, which helped in clarifying the role of MDT team. During the consultation, we also produced a MDT team leaflet for the parents and patient information, which comprised all the details regarding the team and the services we deliver. I would like to mention that during this journey, we were joined by the 2 clinical psychologists, which provided team training, which included connecting with children and families and psychological assessment or screening of the patients, which helped in improving the delivery of our clinical consultation. You can see clearly in this slide that which depicts the change we had. The most important change we introduced was the way we conduct the clinic. Prior to the change, we were all writing and we were hardly engaging with the patients. And following this, only one person was writing, and one person writing and only on one clinic sheet, and we showed the better engagement from the team members with the family and patient, and the more structure to the clinic appointment. And this now better utilization of the time. Next is the outcome data. As we needed some data to support that we are going in the right direction and showing better improvement. We thought of various parameters which can be looked at to show the improvement. We concluded that 4 clinic appointments per year will be an appropriate data to collect and best to demonstrate our improvement. However, it was a short time to collect this data. Therefore, to demonstrate improvement, we looked at all the 7 key care processes in NPDA. This had already started to show improvement before the COVID hit us. Before I pass on to my colleague, I would like to say that this journey gelled all the team members together and created an open culture where we can better communicate and deliver better services to our patients. I will hand over to my colleague, Helen.
Hi, so this is just a bit of the qualitative feedback from families that we got and from colleagues. We did a Survey Monkey for the staff, and that really helped in clarifying the role of the MDT team members during the clinic consultations and what role each of us were doing, so we weren't overlapping. We also, as Sunil's already mentioned, had problems getting some true feedback from families. So we simplified things by using the Pringle boxes, and we just asked simple questions in each clinic, and they were able to put tokens or pasta pieces in the no or yes. So that was just an easy thing that we could do to get some good feedback. And we did give the kids and the parents some feedback forms to get some feedback from that. There were lots of bright spots. The unified clinic sheet worked really well. The clarifying of roles within the MDT as well, we definitely needed to know which one of us was responsible for what, and that helped. This journey has definitely helped with that. We still haven't got ironed out the problems with the booking office completely. There are some issues ongoing. However, we've kind of our communication lines with the booking centre perhaps improved, and we have got to the bottom of why we weren't getting those 4 appointments per year. We've obviously got our psychologists now as part of our MDT, which is a massive improvement. So they're part of the quality improvement as well now. So going forward, and as Sunil's already mentioned, the communication between our MDT and our MDT team leaflet as well for our families and parents is definitely one of the bright spots that's come out of this. Obviously, COVID, as it happened with everybody, obviously, happened just right when we were kind of in the swing of things. And because our QI project is based on face-to-face clinics, which we no longer can do at the moment, then it obviously had a significant impact on our quality improvement. Although I think the tools that we've learned from this programme helped us adapt in a way when COVID hit so much easier than we might have before, because we were already communicating quite well and had the WhatsApp group and had these QI meetings. Then we did change our roles slightly. Obviously, the consultants initially, when the pandemic first hit, were asked to work on the wards. So the dietitians and nurses took on the role of doing the clinic solely initially. We also set up some drive-through HbA1c clinics, which we synced with our clinics then, and then eventually when things settled in Wales, the consultants came back and we set up these Attend Anywhere MDT clinics. And I'm not sure whether we would have been able to do that in such good time without having the QI, the tools to do that. And then so we're going forward now. We're going to try and establish some annual review face-to-face clinics with the virtual clinics on Attend Anywhere in between, depending on how things pan out, really. Yeah. So we're going to continue. Our further actions then are just to continue to work with the booking centre to improve appointment systems. Of course, things have had to change again, doing everything virtually. The booking system algorithms and stuff have had to be discussed and all the rest of it, but we're hoping that will iron out. And we're still trying to get better involvement with the families, because one of the issues that we did find is that we haven't really got any parent representatives at the moment and parent involvement. So we're hoping that will improve going forward and carry on the QI process. Anything else, Sunil?
That's it. Thank you.
Thank you.